Hello and welcome to the pod. I'm Nathan Fink.
I'm Jasmine Torres-Allen, and this is New Hampshire Family Now,
a show about building family in the Granite State. Today in the podcast, Susan Stearns and Melissa Wieters of NAMI New Hampshire join us to celebrate Mental Health Awareness Month. And later, This Is My Brave cast members remind us we matter story by story. New Hampshire Family Now is brought to you by the New Hampshire Charitable Foundation. Since 1962, the Charitable Foundation has worked hand in hand with generous and visionary citizens to maximize the power of giving and support, collaborate, and lead innovative initiatives. Initiatives like New Hampshire Tomorrow, which is focused on making sure children and families have access to education, healthcare, and career pathways to ensure every family member thrives. To learn more about New Hampshire Charitable Foundation and all their initiatives, go to www.nhcf.org. This podcast was also brought to you by Family Support New Hampshire. Family Support New Hampshire is NH's coalition of family resource centers and family strengthening programs that exist to ensure Granite State families have access to resources so both caregivers and children can succeed, because supported families are strong families. To find a family resource center near you, visit www.fsnh.org. Hello and welcome to the podcast. Jasmine is out on vacation, but in her stead, I'm pleased to welcome Executive Director of NAMI New Hampshire, New Hampshire's chapter of the National Alliance on Mental Illness, the Susan Stearns. Susan, welcome back to the show.
Thank you.
And as a guest co-host, you have wiggle room, so if you want to go renegade, by all means.
Well, that's what we like to do at NAMI New Hampshire. We're pirates at heart.
Well, May is Mental Health Awareness Month, and mental health challenges are something that affects us broadly as a country. 1 in 5 here in the United States. But every time I think of mental health challenges that we face, we have this othering where we think it's a individual issue. But this is, in fact, a family issue. I would love for you to talk a little bit about that.
Well, I can just speak from my own personal experience. Having raised a child with a mental health challenge, now an adult, the reality is that diagnosis for my son sent my entire family on a completely different path and redirected my life personally, including my entire career. And at that time, there was very little in terms of children's mental health and supports. There really was no children's system of care. It was incredibly isolating. Even back then, NAMI was not really strong in the children's mental health space. It was just starting to develop. So it's really kind of amazing when I think of my own personal journey that, I can speak to how hard it is to navigate that journey and find hope and hold on to hope in those dark days when you really are feeling alone. So today we have expanded those services. We have robust services. It's actually our children's program is one of our biggest departments. It is our biggest department at NAMI New Hampshire. And we are thrilled to be part of and have been part of the founding of New Hampshire's system of care for children. And we continue to do this work throughout the state and across the lifespan. But the reality is when you have a loved one diagnosed, regardless of their age, with a mental health condition, it impacts everyone in your family. It can impact, everyone in their school, their place of employment. And it is something that there's no one who is untouched by. You said 1 in 5. And if you just think about that, there is no one who's not touched by the realities of what mental illness and the impact it can have on someone's life and their community.
Talk to me about then being a caregiver, because as you mentioned, you didn't see yourself going down this road. How the heck did you essentially grab on and switch tracks?
It wasn't easy. I will say that I was really lucky in that I had, we talk about generational trauma. What comes with that is generational resilience. And there is no question that my mother was a fierce advocate for her children. I never appreciated that until I had to dig deep and find those skills, which honestly, had it not been for my mother, I don't know that I would have had them. And it brings us back to why it's so important that we help people build those skills and be able to advocate for their loved ones, their children, other loved ones, because not necessarily everyone comes with that skill set. I was really lucky. I will say in terms of really understanding the detour our lives were taking, it's better seen in hindsight, honestly. At the time, I just knew I had to do everything I could to try and help my child access the care they needed and to combat the discrimination that, very early on. And my son was first diagnosed with a behavioral health problem when he was 5, an emotional disorder by age 8, and a serious mental illness by the age of 14. I would say pretty much out of the gate from age 5, the shame and blame that was heaped on me as the mother and then also on my son was pretty staggering. I know that still happens sometimes in some places.
Right.
And, NAMI New Hampshire is here to help folks if they find themselves trying to make their journey forward.
I remember early on in my son's diagnosis, we were talking with our childcare provider and we were talking about what our options are for him. And she started by reminding us that we have the child we have. And what we can do is start to better understand the environment that he needs in order to be successful, which was great because it put us in this learner space. Look, the skills that you need to help your child be successful as a caregiver, those are learnable as well, which also kind of harkens this idea of we can create then the environments in which caregivers and those children or others in their care who have these challenges can succeed. So that, to my mind, says, wait a minute, this is not an individual issue. This is not a family issue. This is a community issue. So from that lens, that level, how do we look at community level solutions so people, caregivers, and their loved ones can succeed?
So there are a number of ways, and community gets defined in many ways. So I want to be clear that as we use the term community, it could be a work community, it could be a school community, it could be a faith community, it could be indeed your entire neighborhood or city community, however that's defined. And every single one of those communities is going to find that there is an impact in terms of mental health disorders, and that the reality is every single one of us has a role to play. We all need to be educated because these are disorders that are very common and very treatable. So we want to make sure we have the understanding, we have not just awareness, but we actually have knowledge and are prepared to take compassionate action. Awareness is great, but just being aware isn't necessarily going to change someone's life or set them on a path towards improved outcomes. Mm-hmm. So we encourage people. There are a number of ways that folks can, whether it be through NAMI New Hampshire programs or ones offered through community mental health centers, for example, or family resource centers, that folks can learn about children's mental health or mental health across the lifespan and learn about how to seek support, how to navigate systems, which is really hard. NAMI New Hampshire can assist people with that through our information and resource line, but also encourage people to start developing their advocacy skills. Because one of the things that's really important is that we make sure our policymakers continue to understand how important it is to ensure that there are appropriate investments in our mental health system so that people, kids, adults, older adults, no matter the age, can access trauma-informed, evidence-based care when and where they need it without having to wait for what is essential health care.
I'm so glad you said that about the identification of the problem, because I think sometimes we think pointing at it is enough. That's where the problem stops because you pointed, but that's actually where the work begins.
It is.
And it's heartening to hear that when you talk about the children's system of mental health care. If we can get to this earlier, we can start to work from intervention towards prevention and have better outcomes. Now, in the second half of the show, we bring in Melissa Wieters to talk about the This Is My Brave performance happening on May 15th at Bank of New Hampshire stage with exciting storytellers. Tell me why we should be excited about that.
Beyond the fact that you are part of this project and helping make it awesome. At NAMI New Hampshire, we have known the power of storytelling. Again, it goes back to our early days. We have a number of speakers bureaus where we train people to share their stories of their mental health journey. We also train family members to share their story. We call that speakers bureau Life Interrupted, which, yes, I feel that because that is what happens for a lot of families when this diagnosis comes. But the family's along for the journey, so we train them to share those stories of hope and healing. And we also have our Survivor Voices Voices, which is a speakers bureau for folks who've lost someone to suicide, who, again, are trained to safely share their stories to offer hope and help people find resources and prevent suicide. So I will tell you, I mentioned earlier, we served nearly 44,000 people last year. We do evaluations for really every program that we have here at NAMI New Hampshire, every service we offer. But the most highly rated in terms of their impact are those speakers when they tell their stories. And I'm always surprised, for example, when I do a presentation with, say, medical providers, and who've asked me to come in, doing one soon, actually, for a group of residents around advocating in this space, where we include someone who shares their lived experience as part of that presentation. That, even when you're working, folks who are working with people all the time who have these diagnoses, they still report back. That was eye-opening, hearing someone share their story. That will change how I even do my practice. So, and that's consistent across disciplines. We hear that a lot with our law enforcement training as well. Actually, overwhelmingly, our law enforcement training is like the people with lived experience who come and so bravely share their deeply personal stories make the biggest impact. So, This Is My Brave was a bit of a no-brainer for us when the opportunity came up for NAMI New Hampshire to be a host for This Is My Brave in New Hampshire, because we know that power of storytelling literally changes hearts and minds and creates better systems. So in the end, this isn't my brave. This isn't your brave. This is our brave.
And are there resources available for us?
Absolutely. I encourage folks to visit our website at NAMINH.org. There's a vast array of resources listed there, not just our programs, but other resources in the community. And I want to remind everyone that here in New Hampshire Rapid Response is available 24/7, offers mobile crisis response for adults and children, and you can access that through dialing 988. And I encourage people to remember, you're not alone. There is help.
Susan, thank you so much for coming on the show. It's been a pleasure.
Thank you for having me. It's always a pleasure to see you, Nate.
And when we come back, we welcome Melissa Wieters to talk about This Is My Brave. Don't go anywhere. Today's show was brought to you by Bank of New Hampshire. For 193 years, Bank of New Hampshire has put customers and communities first. With the expertise to help you realize your goals, their technology makes banking easier, and the friendly faces will make you want to visit in person. Want a bank that has your back? Bank of New Hampshire are your people. For more information, visit bnh.bank or call 1-800-832-0912. Member FDIC. Today's podcast was brought to you by Dartmouth Health Children's. As the only comprehensive pediatric healthcare system in the region, Dartmouth Health Children's promotes health, advances knowledge, and delivers the best patient and family-centered care for infants, children, and adolescents. Shared knowledge from expert providers across the system increases their ability to care for patients and families close to home. From annual checkups to specialized treatments, Dartmouth Health Children's is dedicated to ensuring all children live their happiest, healthiest lives. For more information, visit childrensdartmouthhealth.org. That's childrens.dartmouth-health.org. Hello and welcome back to the podcast. Today in the show, I'm thrilled to welcome Melissa Wieters with NAMI New Hampshire and volunteer director of the This Is My Brave New Hampshire performance. Melissa, welcome to the show.
Thank you so much for having me. I'm so excited to be here.
As I mentioned earlier, May 15th, you and a cast of participants will be performing at the Bank of New Hampshire stage in Concord for the This Is My Brave storytelling series. So tell me, what in fact is This Is My Brave?
Sure. So This Is My Brave is a creative storytelling platform or safe space for people with mental illness to share their experiences. It was actually started in 2014 by a woman named Jennifer Marshall, who was managing bipolar disorder and is a young mom. And she started by blogging about her experiences and then decided to have a little show. And now, 10 years later, we are seeing these productions across the country and even internationally.
Why storytelling? What is it about storytelling that is so helpful with regards to mental health challenges?
I think because it's human and it's relatable and it's real. And I think that's the challenge with mental illness, is not talking about it means people aren't getting help. And then you've got pain and suffering. And then communities that, are experiencing all kinds of types of violence, or something even worse. It's just, if there's a worse.
The worst might be the idea that it's generational, that we can't escape it.
But we can.
Right.
But we can escape it by talking about it. That is how we address and end intergenerational anything, whether it's mental illness or our culture, our traditions, how we relate with each other, how we talk to each other, how we develop healthy relationships. We don't do that without talking about it.
We certainly don't.
And this is a show that it's not scripted. There's not an author of this or a playwright. It's somebody's real experience. It's raw. And I think when we start to talk about those things that are hard, things that nobody wants to talk about, that's how we start to end it. That's how we start to heal, not only as individuals, but as a community and as a larger society.
Yeah. So talk to me about then the process of even putting this show together. How do you go from taking, let's say, 10 to 12 individuals who may have various levels of storytelling experience? How do you even go about arranging a show like this?
Well, it takes a village. So I think that we're super lucky. We have some terrific mentors that are working with our storytellers. And these are folks that, are storytellers themselves and are experienced in that line of work, and also have empathy for mental illness. And so they're not only working with our cast members in terms of developing the story in a way that, then can be relatable to an audience, but they're also there just to provide that kind of moral support as well.
Right. Now, when I think about storytelling on a stage myself, it's terrifying. It's hard. It's hard to tell any story in public, let alone the story of you working through, overcoming, even continually wrestling with something like a mental health challenge. So from your lens, why do you think some of our cast members got involved?
First, I just want to acknowledge what you just said, that it is terrifying for folks. This is very vulnerable. People are sharing very intimate, vulnerable emotions in front of an audience of strangers. It's not an easy thing to do. And when we were doing this interview process in the very beginning, this was actually a question: why are you sharing your story?
If we are brave enough to tell our stories, this is how we reduce the stigma of mental health and addiction, story by story. It matters because we all matter.
After my brain injury, I kind of joined the brain injury world. There were the frustration that I had and other people had, and to let people know it's okay.
Mental health just wasn't really recognized when I was a kid. And seeing the ramifications, what is not taught to give me as a parent, as a friend, as me.
Tell me how you came to find yourself wrestling with a mental health challenge.
So in my 32 years as a firefighter, I encountered so much trauma. There wasn't a street in this community that I hadn't been down at some point in my career. But what you do is you suppress all that experience deep down inside of you so that you can perform at the next fire, at the next wreck. And so what happened was, when I retired from the fire department, the dam just burst. Lake PTSD, I call it sometimes, just flooded down through the valleys of my mind and just consumed me. And the first thing I did was I reached for a bottle to numb it all.
I was driving through an intersection and a drunk driver came through the intersection and he hit me and spun my car around. My drunk driver didn't have a lot of resources. Insurance ran out and I was fine. My head was ringing. I was fine. And then the next day I wasn't. I started getting a little, anxiety that I didn't have. And then the next day, my words, I I'd like to go to say yellow and I'd say yield. And I'd go to say, and things were a little off. And by the 5th day, I was in the hospital trying to figure out if I had a brain bleed. Before the injury, I think I was someone that did everything for everyone, as a parent, as a person, as a teacher. And after the brain injury, there was ambiguous loss. I lost myself. I didn't know who I was.
I was always an anxious kid, but I didn't know it. So that was definitely maybe 7, 8. And that's when I first noticed, I'm like, other kids don't look like they want to die inside. And it's somebody with a mental illness, whether it's depression, whatever. I was judging their outsides against my insides, and I would lose every time. And, my life intersected with a priest who should have been stopped a long time before I got into his life. And that, I don't know if my depression was treatment resistant before then, but sure as hell became intractable after that. Then there was substance use disorder came into the picture, whatever the system has to do to survive and keep going. And 16, I was in counseling. By the time I was 19, I was in treatment. But the thing is, once the drink was gone and other things, there was nothing keeping the ugly head of the treatment-resistant depression from popping back up. And that's when things really became fun.
So with that in mind then, what do you hope the audience takes away from your piece on the This Is My Brave performance?
I had this silly notion when I got into recovery from substance use disorder, and then, now I got this depression thing that I deal with. I had this silly notion that, I'll just put my head down, blow through this. I'll be over this in like a couple months. That maybe this is a lifelong thing for you, whoever that you is out there listening. But you know what? You don't have to keep carrying that heavy, cold bag of whatever on your back. That's your depression.
Hope. I want you to walk away with the knowing that you're not alone and that you can reach at any moment. And there's a voice and there's a person and there's someone there to hold you up.
There are 25 million people in this country living in recovery, living good lives with clear eyes and open hearts. That is a story of hope, and that's what I want to bring to my This Is My Brave performance.
I mean, going through a process like this, telling your story on stage and preparing for it, it changes you.
Yeah, it's been an amazing opportunity for me to witness how this whole process has unfolded and how it has impacted our storytellers. We had folks come in and do the audition, and many of them had never told their story before. I was blown away. Mm-hmm. Don was one of those auditioners who came in, and he played his piece, which is very powerful, and then said, I've never performed this in front of anybody before. This is the first time. And to watch somebody like Don and others start there and then get comfortable with just their piece, their story, whether that's musical song or if it's like Liz has just a wonderful way of an art of telling story through photography. It's incredible to watch folks get comfortable with that. And then as they get more comfortable, how they become more proud. And to see the pride overtake the fear has been amazing.
Now, I can't possibly imagine a scenario where you, watching change, don't change yourself.
Yeah, I think for me, I have my own story that I have not shared. And there's a reason that I am in the role that I'm in, because I'm not ready to share my story yet. But watching others share their story and seeing how that has changed them is so inspiring that it just makes me want to go outside and yell right now, hey, I've got something to say. I've got to tell you, I have a mental illness. This is my story. This is how I've evolved, where it's come from. And so I think it's just been so inspiring. And that's really the goal, right? The goal is to inspire other people to get help, to reach out, to tell their story to somebody else, so that we're talking about these things that are hard issues. We're not stigmatizing, we're not shaming, we're taking that shame off the table and we're just talking about stuff.
Yeah.
This is probably one of the most important projects I've ever worked on in my life. It's been amazing.
Well, it's funny because I start the whole poem with a trigger warning because the picture is a little challenging to look at. And I start with trigger warning. If this picture is too much to look at, the words might be a challenge too. Protect your heart, leave, come back or don't. It's you that needs to decide. Do what you need to do. Like, seriously, don't go on if you can't handle it. I think I'm writing these words especially for me to hear.
I'm so used to thinking, what if people find out? Find out what? My depression is something that happened to me, not something I earned. To say this in front of people, I have depression and it's ruined most any opportunity I've had to turn objectives into goals. To say depression is the most debilitating manifestation of childhood trauma that I went through. To say depression at all. My name is Brian Harlow, and this is My Brave.
My name is Liz Stella-Ford, and this is My Brave.
My name is Don McCullough, and this is My Brave. When the world becomes too much, and it feels so easy, oh, so too easy, just to lose touch. You feel lost in a crowd, and the thunder's too loud. You're not alone. No, you don't gotta be lonely. Oh, when you feel like nothing matters, baby, you matter to me. It's a crazy world, all that we live in. It seems so easy, oh, so easy, just to give in. People, they just pass you by while you stand there and cry. When cold faces are all you can see. Oh, when you feel like nothing matters, baby, you matter to me. Baby, you matter. You matter to me. Baby, you matter. You matter to me. You're heard and you're seen. Baby, you matter to me. We need to feel like we belong and be the hope, or the hope in somebody's song. We just wanna be heard and taken at our word. Give the day to itself, just let it be. Oh, you're here and you matter. Baby, you matter to me. Baby, you matter. You matter to me. Baby, you matter. You matter to me. You're heard and you're seen. Baby, you matter to me. Baby, you matter to me. Baby, you matter to me.
This podcast was brought to you by Nixon Peabody, who delivers exceptional legal services for clients in the community by combining high performance, an entrepreneurial spirit, deep engagement, and an unwavering commitment to a culture of collaboration, diversity, and humanity. Nixon Peabody works with universities, hospitals, and nonprofits of every size to maximize impact. For more information, visit nixonpeabody.com. Many thanks to the Samuel P. Hunt Foundation for sponsoring this podcast. Established in 1951, Samuel P. Hunt Foundation is a Manchester-based, independent nonprofit that provides grants primarily for the arts, children and youth services, faith-based organizations, educational institutions, healthcare, and human services. New Hampshire Family Now is listed on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, iHeartRadio, and more. Listen wherever you get your podcasts or ask your smart speaker to play New Hampshire Family Now.